Hello, and welcome to the online training module on strengthening sibling relationships for youth in foster care. This training is brought to you by the Center for Advanced Studies in Child Welfare at the School of Social Work at the University of Minnesota. This training module is part of an online training effort that covers a wide range of topic areas in child welfare. In this module, I'm going to talk about the importance of sibling relationships for youth in care, including current research findings in this area. Welcome to the online training series. By the end of this module, you will have learned about the importance of sibling relationships, particularly for youth in care, interventions that have been shown to improve various aspects of sibling relationships, and strategies you can use to improve sibling relationships for youth in care. Sibling relationships are a common experience for youth. 8 out of 10 youth in the United States grow up with a sibling present in their household. In fact, more youth live with a sibling than live with a father. Outside of school, youth tend to spend more time with siblings than with anyone else, including peers and parents. Sibling relationships often span across youth's life, making it one of the most long-lasting and significant relationships. This provides an opportunity for an important bond that endures across many stages of development. For decades, researchers have recognized the unique role siblings can play in children's development. Siblings have been found to have an impact on children's cognitive, social, and emotional development, as well as the development of psychopathology. Siblings develop unique relationships that have influences independent of other family relationships or dynamics. Siblings may play a beneficial role by providing a peer with whom a child can explore and develop social and cognitive skills. For example, children who have an older sibling tend to develop theory of mind, which is essentially the ability to take another's perspective, language skills, and empathy at earlier ages than children who do not have an older sibling. Furthermore, children with siblings tend to develop more advanced problem solving, negotiation, and emotion regulation skills compared to children with no siblings. This indicates that children might use siblings as a way to engage with the world in a way they would not with a caregiver, even if the sibling was absent. Children with older siblings have also been found to be more likely to achieve academic success, such as mastery of subjects and high school graduation, compared to children with no siblings. Healthy sibling relationships can guide other relationships in children's lives. Children with healthy sibling relationships are more likely to have healthy relationships with others, including peers. However, sibling relationships can also have a negative impact on mental health outcomes. For example, sibling conflict has been found to predict internalizing problems such as depression and anxiety, as well as externalizing problems such as antisocial behavior. Furthermore, children who have older siblings that misuse substances are more likely to misuse substances themselves. Healthy sibling relationships are particularly important for youth living together or separately in care. Fostering warm and supportive sibling relationships are particularly important as they can help reduce stress, improve mental and behavioral well-being, and provide a source of relational continuity and permanency during and after youth stay in care. Research indicates that siblings who are placed together tend to have fewer problem behaviors and specifically fewer internalizing behaviors such as anxiety and depression compared to siblings placed apart. Furthermore, siblings placed together experience fewer unwanted placement changes and more rapid exits to permanency. We have established that sibling relationships can greatly influence children's development, but why are these relationships so impactful? One explanation, drawing from social learning theory, is that youth learn behaviors, both good and bad, by observing and then imitating their siblings. For example, youth may model their older siblings' interest in school, resulting in academic success. However, they might also model their siblings' substance use, leading to a substance use disorder. It is also possible that older siblings influence younger siblings' development by helping shape family norms and expectations. An older sibling that rarely misbehaves and does well in school might influence parents to hold a younger sibling to that expectation. If an older sibling misbehaves, parents might think of this behavior as more normative in younger siblings. Furthermore, interactions between siblings allow for a safe environment to practice skills. Children can work on skills such as negotiating and problem solving in a low risk space where it is safe to fail and try again. Additionally, younger siblings might also more quickly learn advanced skills while practicing them with their older siblings who already mastered those skills. Lastly, sibling relationships can be a source of emotional support, particularly for children in foster care. This may reduce stress, facilitating positive development. However, sibling relationships can also be a source of conflict and competition. While some sibling competition is normative and not problematic, too much might result in hostility between siblings and lead to negative outcomes. Now we are going to discuss a variety of different interventions that have been shown to improve aspects of sibling relationships and child outcomes. Sibling interventions involve two or more members of a sibling group, though may target only one member of the group and are facilitated by a trained adult. This could be a coach, clinician, or caregiver, among others. Sibling interventions build on children's individual skills as well as interpersonal skills to help facilitate a healthy sibling relationship. Interventions utilize the sibling relationship as a space to learn, practice, and reinforce skills. The More Fun with Sisters and Brothers intervention was developed by Kennedy and Kramer to improve sibling relationships for children aged 4 to 8. The program includes 5 one-hour training sessions, with 4 taking place in a lab setting and the last one taking place at the youth's home. Throughout the program, children are taught emotional and social skills. Parents observe children during the program, and trained facilitators explain to parents how to reinforce these skills at home. A randomized controlled trial found that the program improved sibling relationship quality and emotion regulation, and higher levels of emotion regulation were associated with more positive sibling relationship quality. Furthermore, children in the intervention group required less parental direction needed to control negative emotions. These findings highlight the importance of improving children's emotion regulation skills to promote healthier relationships between siblings and the role a caregiver can have in this process. The next intervention is called Siblings Are Special and was developed by Feinberg and colleagues. This program was designed for 5th graders who had younger siblings in 2nd through 4th grade. The intervention was designed as an after-school group program and included 12 sessions for youth and 3 family nights that included parents and siblings. The intervention aimed to prevent behavior problems by enhancing socio-emotional competencies and parents' ability to manage sibling relationships. Specifically, it aimed to enhance warmth, responsibility, and joint decision-making in sibling relationships. It also intended to increase individual socio-emotional competencies such as emotion understanding, self-control, perspective taking, and problem solving. Lastly, it aimed to improve parental involvement in the mediation of sibling conflict, parents' knowledge of sibling dynamics, and increase time parents engaged in shared activities with sibling dyads. The random control trial found that the intervention successfully enhanced positive sibling relationships as well as improved youth's self control, social competence, and even their academic performance. Supporting siblings in foster care is a sibling intervention designed specifically for children in foster care, developed by Cathari and colleagues. This intervention was designed for older siblings between ages 11 and 15 who had a sibling less than 4 years younger. The program included 12 sessions, including 8 skill building and 4 community based sessions. The skill building sessions focused on enhancing youth's self regulatory skills such as cooperation, communication, emotion regulation, and problem solving. The community based sessions involved youth participating in community activities such as taking a trip to a local museum to practice the skills they learned. The program also included practice approaching adults for support during sibling conflicts. The random control trial found that the program improved sibling relationship quality and interestingly found that siblings living apart had greater improvements in relationship quality than those living together, perhaps because their relationship was of lower quality at the beginning of the intervention because of the separation. The last intervention I will discuss is Camp to Belong, which is a multi site program that provides brief, camp based reunification to siblings aged 6 to 21 years old who've been separated by out of home care. The camp is 1 week long and has been implemented in sites around the United States and Australia. Camp to Belong utilizes a positive youth development framework to provide siblings with opportunities to engage in typical camp activities, such as canoeing, archery, ropes courses, and field games, along with other events that are designed to strengthen sibling bonds and promote feelings of belonging among siblings. Results from evaluations conducted by Wade and Wojak revealed that across multiple years and sites, camp attendance was associated with a reduction in sibling conflict and increase in youth resilience. Now that you have a foundational understanding of the research in this field, I'm going to discuss applications of that knowledge to practice. What strategies can you use to promote and strengthen sibling relationships for youth in foster care? First, it is important to recognize that youth might have a different definition of siblings than you. For example, some youth may have strong bonds with step-siblings who might not be recognized as siblings by third parties. Allow youth the opportunity to share who they consider siblings. Next, because we know that youth's well-being is closely linked to their siblings, routinely incorporate questions about siblings into assessments of child safety and well-being. Also, when siblings are not able to be placed together, ensure they have consistent, ongoing opportunities to connect. This will allow them to maintain their bond and provide some degree of emotional support to one another while separated. Another strategy is to create opportunities and encourage siblings to engage in normative developmental opportunities together, such as camps, sports, after school programs, and other extracurricular activities. Additionally, it is important to teach siblings how to take a strengths perspective and to utilize that perspective in their interactions with each other. This perspective emphasizes youth's capacity for resilience and the abilities they possess to achieve their own goals and aspirations. Next, create opportunities for siblings to learn and engage in problem solving activities together, which will promote important skills that will help facilitate healthy sibling relationships. Also, encourage, role model, and reinforce positive communication skills that siblings can use during conflicts. Lastly, teach youth emotion regulation and coping skills and encourage the use of these skills when sibling conflicts arise. Healthy emotion regulation and coping skills are linked to an abundance of positive developmental outcomes and can specifically improve sibling relationships. In sum, sibling relationships play a key role in development for all children, and particularly for children in foster and adoptive care. It is essential to help children develop positive, warm relationships that are not characterized by high levels of conflict. Many interventions exist that can help promote positive sibling relationships and decrease conflict. Caregivers, caseworkers, and clinicians can utilize a variety of strategies to help children improve sibling relationships. Thank you for watching.